So today we're approaching a question that I get asked a lot, which is that what is the most challenging surgery you've ever done? Well, the answer to this question is always that every surgery has challenges, and you have to approach every surgery as looking at the worst case scenario, because you always have the risk of making the patient worse if you don't approach every detail and address it properly. But this case below was one that I did recently that is particularly challenging and is memorable. So this is a 77-year-old gentleman who presented to me progressive weakness involving the legs and difficulty walking. His medical history was significant for prior tumor resection done in the 1980s, which left him incontinent of bowel and bladder. He said at that time he had similar symptoms, difficulty with walking, and as a result of the bowel bladder issues, he had a bladder stimulator placed, which prevented him from getting an MRI. So we got a special scan called a myelogram where they inject dye along the nerves. And as you can see here above the surgery, along the L2 area, there's a large mass that appears to be compressing on the nerves. Because of the compressive symptoms and because of the neurologic deficit that he was presenting with, it seemed pretty clear that he needed surgery. In addition, you can see he developed what's called an iatrogenic slip, a spondylolisthesis at the L2-3 level, which basically becomes from excessive removal of bone, which results in instability or abnormal movement in the spine. Now, it's important to note that in spite of these problems, you can't say that the surgery that was done earlier was a failure. In fact, this surgery preserved his quality of life, kept him walking, and basically kept him tumor-free for over 40 years. So this is a patient who was able to undergo a pretty normal life other than the bowel issues that he had. But clearly, the tumor appears to have recurred and surgery was required. So in this case, I ended up doing a laminectomy and a fusion. The fusion was required to reduce that slipped fragment at L2-3. Tumor ended up being an epidermoid tumor, which is a tumor that involves the epithelial cells, rarely comes in the spine. These can be locally invasive and recurrent, but fortunately removal of these can oftentimes be curative. The tumor is successfully removed. He is doing well, is ambulatory. These x-rays were done a year later. As you can see, he does have reduction of that slipped fragment as well, and he continues to do well at follow-up.